Doctors at Central Maine Medical Center are raising awareness about new treatments for atrial fibrillation that they say are safer and more efficient. Atrial fibrillation is an irregular heartbeat. It can lead to blood clots, stroke, heart failure, and more complications. And a study from the University of Illinois College of Medicine published in November found that Maine had the second highest rate of people with AFib in the entire country. We spoke to doctors performing these new procedures about why they say these could help you live longer.
You had no energy, you just want to lay down, and your heart would pound so bad it actually caused chest pains at times.
Dan Herrick is describing his atrial fibrillation, an irregular heartbeat. The biggest concern is that AFib can cause a stroke. The number one treatment? Blood thinners. But for Dan, blood thinners put him at risk in his work as a farmer and contractor.
It's a scary feeling when you know you just poked yourself or you banged yourself or scraped yourself and you look down and you're dripping. And sometimes it's dripping more than you like to see it drip.
Dan had to second guess every move he made until he qualified for this new treatment called pulsed field ablation. It uses electrical pulses to essentially turn off the triggers of AFib.
And since then, how much AFib have you had?
Dr. Joseph Delorfino is an electrophysiologist at Central Maine Medical Center. He's one of just a handful of doctors in Maine who can perform this and another type of procedure that can prevent the heart from going into AFib.
All three of the hospitals in Maine doing ablations are using pulsed field ablation, and it seems to be the standard of care now. It's important because a stroke can be debilitating, and we can absolutely prevent a stroke, and we can help with atrial fibrillation.
Designed to safely advance and...
The other procedure is called the Watchman. It acts like a cork that goes into the left atrial appendage. It's like a little bag off the side of the heart where blood clots form. The Watchman forms a wall to prevent the clots from coming out.
So that's the big benefit. You have protection against a stroke, and you don't need to take a blood thinner.
Dan had the Watchman procedure done as well. Peace of mind that he says is priceless.
Beautiful. That's what we want to hear.
I went through a small procedure. It was in and out, day surgery, and if that's all you have to do to get off blood thinners, why not? Why not?
Maine Health and Northern Light Health also offer these treatments, but keep in mind, to qualify for these procedures, doctors must determine that blood thinners are not the right fit for the patient.